Hey everybody, it's Rachel here, aka the Nail Therapist. Welcome back to my channel. Today we're going to be doing a pedicure, a very meticulous pedicure, on a woman with pincer nails. A lot of her nails, I think almost all of them, are misshapen due to the squeezing and forming the pincer nails. So you'll see how I work on those nails and what I do to help trim them and make sure that they grow in as straight as possible. And I'll talk to you a little bit about pincer nails and why they happen and what you can do to resolve them. So stay tuned. Okay, so the first thing I'm doing here is trimming the length of the nail, and as you can see, as I cut into that side of the free edge, it's sort of splintered down a little lower than what I wanted to be, but that's the danger whenever you're clipping somebody's nails who have harder, thicker nails. They tend to splinter off whenever you clip them. And sometimes it just goes in the direction where you weren't planning it to go. So I end up having to cut her nail a little shorter than what I intended it to be, but we're all able to fix it in the end. Later in this video, there'll be a pop quiz on a Rachel Reveals. In previous videos, I have told you guys a little bit about myself, certain aspects of my education or things that I do, and so I wanted to celebrate reaching 1,000 subscribers by giving you a chance to win a Revive Nail Studio product. So either the Recover Nail Treatment Oil, which is an antifungal oil, or the Revive Nail and Cuticle Salve. Those are my two top selling products. So stay tuned for that question. The first person to answer it in a complete form will win the prize. Okay, so let the competition begin. Alright, so while you're watching me push back some cuticles, I thought I'd take some time to talk about pincer nails in general. I did a little bit of research yesterday, and I have some notes here. I just wanted to make sure I talked about everything. But what is a pincer nail? A pincer nail is a nail that is wider at the base where the matrix lies and squeezes inward as the borders of the nail curl under. It can form eventually into a trumpet nail, or another way they phrase it is an omega nail, where it's so curled around it's almost a complete circle. Obviously, she's not in that range yet, but the pincer nail, there's an actual twisting of the nail underneath, and so it doesn't grow straight. It kind of grows into a V shape if it was long enough. And they form by different ways. There's a lot of different theories, and so the two ways most people talk about in a broad sense would be acquired versus hereditary. So a lot of times there are people who are born with these nails, and it's not super common. Most of the time they're acquired over your life, and there are several reasons for that, and I'll go through a few of the major ones. So apparently, if you are using beta blockers on a long-term basis, you are at a risk of developing pincer nails. And the study I read didn't go into great detail about why that was, and even if it did, I probably wouldn't understand it, because there's a lot of pathophysiology when it comes to medicine and how it interacts with a bunch of different pathways and whatever. But I think the overall theme is it can affect your microcirculation. When the circulation of your around your nails is compromised, it reduces the amount of oxygen and iron and nutrients, and so that ends up affecting how the nails grow. And they've seen that once you stop taking beta blockers, the nails eventually return to a normal shape, which I thought was very interesting. It was reversal of the symptoms. So interesting there. Other diseases that can cause pincer nails include gastrointestinal malignancies, so tumors or cancers in the gastrointestinal system, renal failure, ALS, like Lou Gehrig's disease, lupus, and just general things like osteoarthritis of the distal interphalangeal joint, so the last joint of the toe. The reason behind the osteoarthritis theory is when you have an osteophyte or an overgrowth of bone at the distal phalanx, that results in an over curvature of the nail that's forming off the tip of the bone. And when there is a difference of the side of the ventral and dorsal side of the nail plate, it causes the pincer nail deformity through the nail bed shrinkage. Okay, so like, what does that mean? I need a picture. So picture a plate, and you have the top of the plate on one side and the underneath side of the plate. That's the dorsal side. So the ventral side's on top, the dorsal side's underneath. And one side is, so the top side is bigger, it's longer, it's wider, and the underneath side is smaller. So as the nail grows forward, because of the way that the top of the nail is bigger than the bottom of the nail, it begins rolling around and underneath, pressing against the nail bed, and that causes the nail bed to shrink up because it doesn't have as much underside of the nail attaching to the actual nail bed. And so the sides of the nail curl around because of the downward pressure of the top of the nail plate. I need like a video of my gestures so you can see what I'm talking about. But hopefully that was a little bit more easy for you to understand and picture. All right, so as you can see, as I'm cleaning out the sidewall here, there's a piece of nail that I didn't quite get whenever I was originally trimming it, and that is the danger of trimming the pincer nails or nails with very deep sidewalls. You have to make sure you get all the way to the lateral border when you're cutting them, or else you'll leave a piece of nail called a spicule behind, and that can cause a lot of pain and discomfort and become an ingrown toenail. So make sure that you're using your sidewall cleaners to get all the way down and clean around the edges so you can see that they're clear of any spicules. Okay, and another reason for pincer nails, that is another theory, I should say, is due to mechanical forces. So there's a downward force of the nail onto the nail bed, and there's a concurrent upward force from the nail bed to the underside of the nail. And so when the downward force is greater than the upward force, that's when you get the pincer nail. So the nail will curl down and around because there's not enough pressure coming upward to flatten out the downward force. And we see a lot of this in elderly patients who aren't mobile, so they're not on their feet a lot. They're often bed bound, and so the pressure of the nail just growing will cause it to curl down and around. And then there's the just regular version of events, which is a lot of the time the problem is your shoe wear, right? So if you wear tight fitted shoes with your toes kind of smashed together, the external pressure from the shoes and the socks against your feet will cause the toes to crowd and press against each other, and that causes pressure on both sides of the nail, and the nail will end up curling inward to accommodate for those pressures. So what do we tell our clients? I mean, the short answer is we can tell them all these things, but the problem is we're not doctors, and we don't have the time or the training to sit and do a deep evaluation of their history, their life history. So we can tell them there's a few reasons why this happens, and then they can choose which one might apply best to them. And if they really have concerns with their toes, then that's when you would refer them to a podiatrist so that they could, you know, do more deep diving into the causes if they wanted to. On this big toe, you can kind of see the middle of the toenail is a little bit wider than the sides, and it's a little thicker in the middle where it's most bent. And some of the whiteness is due to the layers of the nail splitting apart a little bit. So if I were to take the e-file and try and thin that out, it would delaminate. It would start to flake apart right in the center there, because you can see where it's not one cohesive plate, just by the coloration of the nail. Okay, so this is the question of the day. This is to win a jar of the Revive Nail and Cuticle Salve, or a pen of the Recover Nail Treatment Oil. So you must answer this in complete form, and the first person to do so will be contacted, and I'll figure out how to get that product to you as soon as I can. So the question is, what school did I go to earn my physical therapy degree? What school did I go to earn my physical therapy degree? Put the answer in the comments, and I will announce the winner in my next video. Also, make sure that you live in the United States if you're answering this question, because I can't send things internationally. So sorry guys, if you're an international listener and you know the answer, I don't have the ability to send things internationally right now. So you can still play along, but if you are from outside the United States, you'll just get a big good job. All right, so you might be wondering, what do we do as nail technicians to help people with these pincer nails? Depending on the severity of the nail and if it even bothers them, there's a lot of different things we can try. If the nail doesn't really bother them, all we need to do is just maintain them and keep them short and cleaned so that the excess skin buildup doesn't create added pressure and lead to pain. If they're having a lot of curling and it's starting to bother them in their shoes or just in daily life, you can try debulking the nail a little bit, as long as it's thick enough. You don't want to go too thin with the nail, but you can debulk the nail, and that relieves some of the downward pressure into the sidewalls. And then the other option would be to give them some 40% or more urea gel. Topical urea, you can put on the nail. It absorbs into the nail and it holds moisture and it softens the nail itself. So you can debulk the nail and then give them some urea to take home with them. They can apply it once a day and do that for a week or two and see if that helps to relieve some of the pressure by increasing the moisture content of the nail. You have to be careful with urea because if you overdo it, it can start to degrade the nail itself, because once you hit the 40% and higher, it starts to break down keratin. So you don't want them to be on it permanently. It's a short-term sort of situation that they have to be on it. So that's one option you can try. Another option would be to apply some sort of topical bracing. There are several different types of bracing. One is the BS brace system that the North American School of Pedology uses. There's another one called the Curve Correct, which you can buy online. It's an at-home curve correct system. I have that. I like that because it has a bunch of different tensions that you can use on the nail depending on how thick and small or large it is. And there's the Onifix system, which is another topical bracing system that is more permanent as far as staying on the nail. Once you apply it, you only apply it once, and it grows out with the nail. And then there's a couple other bracing systems that I don't know a lot more about. I've just seen them. The one thing I've started doing is using polygel instead of the topical brace for really curled nails. The one problem with topical braces like the BS brace or the Curve Correct is that they are a flexible band that you glue on top of the nail. And because if the nail is really curled, it creates a lot of stress in the band, and it can often pop up and fly off too soon before the curl of the nail is corrected. So when my client's nail is more excessively curled, I opt to try the polygel band. It's like the Onifix band that you would apply, and allow that to help to flatten out the curl first. And then if there's more work to be done, then the Curve Correct can be more easily applied and be a lot more effective. So that basically wraps up my spiel on pincer nails. There's a few more details that I could go into, but I feel like I've talked your ear off about it at this point. I do have to say, there's one more thing I found out when I was doing my research yesterday. That there is a study, and it's only a case study, so it's not something that's used a lot, if at all, with the podiatrists that may treat pincer nails. It's for more milder cases like this client that I'm working on today. And it is the application of a topical 0.1% gel of tazarotene, or I don't know how to pronounce this drug, but it's tazarotene. I don't know. Anyway, it's a drug that is often used for things like acne and psoriasis. It's derived from vitamin A, so it's like a retinoid. And what it supposedly does is modulates the keratinocytic proliferation. So in other words, it changes the way the keratinocytes, the keratin cells, proliferate, so divide. And so it makes it more of a normal, steady state as opposed to an overproduction, I guess. And so they found in this one case study that when used for 3 months twice a day, it helped to flatten out the pincer nail. So that's one other option. You could go to your podiatrist and ask them about that if you are curious about trying something a little bit more just easy to maintain. So, all right, so I'm going to just be quiet for the rest of the pedicure basically and just let you watch and enjoy the music and chill out. Okay, I fibbed. There is one more thing I need to mention. So, if you enjoy my content and you are interested in taking an online course to increase and expand your knowledge on all things nail fungus, I am putting together an online course for nail technicians to learn all the ways of the nail fungus, how to overcome nail fungus, what types of nail fungus there is, what to tell your clients, how to help them care for it, all the things nail fungus that we never learn in school. I am putting together an in-depth course on mastering that. If you are interested in getting information about that course and you want to see an outline of what that course will entail, there is a link in the description that will take you to a little form, and I will send you a PDF with an outline of the course, and also you'll be put on a list for when I launch my course. You will be the first to know. So I am super excited about this course. It's just the first course that I'm going to offer in my new Revive Nail Academy, and further courses will come as the days go on. I hope to do one on things like pincer nails, ingrown nails, and a bunch of other topics. I have a list of them. So it's just the beginning of all of that, and I wanted to start off with a bang. So I hope to bring you guys the best information out there on all of these subjects. I am very passionate about helping other nail technicians learn and be the go-to source for their community in terms of all things nail and foot. So hope to see you guys at that course when it comes out. The one thing I forgot to mention as far as treatment of the pincer nail goes, for those of you who are familiar with Lori's channel, she often says to use the nail mycosis. And I think the reason why she says to use that is because it has, it's mostly a vegetable glycerin, which is a water-based extraction, I guess. And it helps to hold water in the skin. So it helps to plump up the nail, it helps to plump up the skin and retain the moisture levels. And that will help to relax the toughness of the nail and its curl. So you could try using the nail mycosis as well. I currently am about to launch a new product called Remedy, which is formulated sort of around the nail mycosis, except it is an all-natural and non-toxic formulation in comparison to the ingredients in the nail mycosis. So once that becomes available, you could probably try using that as well to see if that helps relax the pincer nail too. I went ahead and skipped the filming of the foot file and the massage, so now we're just back at the very end of the pedicure where I make sure all the cleaning is done before I send them on their way. I don't have any before and after pictures of this video, unfortunately. I wasn't thinking about that when I started her pedicure, so I apologize. But I do want to thank you for hanging out with me today. I hope you learned something. If you have any questions, please post them in the comments. That's how I know what to help post about next. And if you like my videos, I hope you subscribe and share the videos with those that you think might benefit from it. Thanks again, and I will see you again soon. Have a great day, everyone.